let's see a short video on pH electrode and carbon dioxide electrode. Okay. Before we move on, what is called pH? So what is pH? So everybody first tells it's a negative logarithm to the base 10 of hydrogen ion concentration. That is a definition. But what does pH stand for? Okay. So pH stands for power of hydrogen. Okay. Now is this power a power which we use in physics? No. This is the power which we use in maths, that is in algorithms. Okay. So here now the definition comes. The pH is called the negative logarithm to the base 10 of hydrogen ion concentrations in moles per liter. So this is the formula or equation for pH, and the definition is power of hydrogen. Okay. Now let's see. Let's say a pH, find out a pH for a concentration of 10 raised to minus 7 moles per liter. Let's apply the formula. pH is equal to negative logarithm to the base 10 of 10 raised to minus 7. Anything to the log 10 raised log to the base 10 is equal to the 10 raised to the value. So here pH is equal to negative of negative 7, which is equal to 7. So this is the base rule in pH. That is, for a pH of 7, the concentration is 10 raised to minus 7 moles per liter. The pH 8, it's 10 raised to minus 8. pH 6, 10 raised to minus 6. pH 9, 10 raised to minus 9. And the pH of neutral water, it's considered as, pH is also taken as neutral, and the pH of water is equal to 7. So these are the two rules or base rules for pH. Okay. Now a small hack to remember the hydrogen ion concentration with corresponding pH. Okay. Just write down these values: 30, 40, 50, 60. Alright. Now corresponding to this, let's see what would be the pH. So here we are writing it in terms of nanomoles per liter, and here to find out the pH, just subtract from the value 8 to this number. So this pH would be 7.5, 7.4, 7.3, 7.2. So this is just a small hack, and this pH range is the one we usually use in all formulas and calculations. So this would be helpful for further assessments. All right. Okay. Now, after we have understood this, before we jump to the electrode, in the oxygen electrode video, we saw the oxygen electrode is a amperometric electrode, right? Whereas the carbon dioxide and pH electrodes are potentiometric electrodes. Okay. Now, in the name itself it's there. What is amperometric? This produces current. Then what is potentiometric? It would produce a potential difference. So for oxygen electrode, it's amperometric or current producing, which has a cathode and an anode, which is a positive and a negative. But here, since it is a potential difference, there will be a measuring electrode and a reference electrode. Okay, this is the basic difference and understanding between oxygen electrode and pH and carbon dioxide electrodes. Okay, now let's move on to the first electrode, that is the pH electrode. Okay, so as we said, it is a potentiometric electrode. So here what we have, is a measurement electrode and a reference electrode. In oxygen electrode, we saw a cathode and anode. Here it's a measurement electrode and a reference electrode. Now, the reference electrode consists of mercury and mercury chloride in KCl buffer, okay, and it's separated by a semi-permeable membrane. This semi-permeable membrane's function is quite often asked. The function is to prevent protein contamination. During regular use, to prevent the protein deposition or contamination, this semi-permeable membrane is used. The measurement electrode. It consists of silver or silver chloride electrode in hydrochloric acid buffer, and this is present in an ion sensitive glass. Now, in the sample chamber, the blood is kept, and from there the hydrogen ions move towards this measurement electrode. Once it moves here, there is a potential difference that exists between these electrodes, and that is measured by this sensing unit, and the values are displayed. Okay, this measurement is almost always constant. That is, there will be an output of 60 millivolt for 1 unit change in pH. That is, the pH, the voltage that is measured will change by 60 millivolts for every unit change in pH. And a point to be noted is this electrode has to be maintained at 37 degrees centigrade. Now, why is that? As the temperature increases, we know the association and dissociation of acids and bases increase, right? So, for that reason, this has to be maintained at 37 degree centigrade. Okay. Now, what are the issues that can happen with this electrode? Before that, one more point is this electrode has to be calibrated. With what do we calibrate it? With two known pH of buffer solutions. With two solutions of known pH, we calibrate this electrode with. Now, let's come to the errors or possible errors in these. One can be due to calibration error. When either of these calibration is not proper, the electrode can malfunction and show varied values. Another would be the membrane damaging. Once the membrane gets damaged, there will be protein accumulation resulting in the inaccuracy of the electrode. Or temperature. If there is hypothermia, that is temperature reduces, the solubility of CO2 increases, resulting in reduced PaCO2. So once PaCO2 is reduced, we know what will happen to the pH. The pH will increase. That is, the sample would be read as more basic. Also, sampling error. During sampling, what error can happen? We take in a heparinized syringe, right? When there is excess of heparin, we know heparin is an acid. So what does an acid does to the pH? Then the pH would be abnormally low. All right. So that concludes the pH electrode. So very short descriptions, right? Now let's go on to the next one, that is carbon dioxide electrode. Yeah. So for carbon dioxide measurements, carbon dioxide usually is assessed in the intraoperative period using arterial blood gas analysis and also capnography. Capnography will be dealt in a separate video. Here we are going to see just about the carbon dioxide electrode. So carbon dioxide electrode is nothing but a modified pH electrode. That is why we said both pH electrode and carbon dioxide electrode were potentiometric electrodes. All right. So carbon dioxide electrode is nothing but a modified pH electrode. So most of the stuff remains constant. It has a measurement electrode, it has a reference electrode, everything ticks. The only difference or addition here is a sodium bicarbonate solution. This sodium bicarbonate solution is acting as a buffer in the measurement electrode, as well as there is a carbon dioxide permeable membrane that is present for the facilitation of carbon dioxide. Okay. Now what happens when carbon dioxide goes inside? We know carbon dioxide combines with water to form H2CO3, which in turn forms bicarbonate plus H plus. So this H plus again causes a potential difference between the electrodes, and hence the measurement of carbon dioxide from the sample can be done. So again, this electrode also has to be maintained at 37 degrees Celsius, and it is also calibrated with a solution of known CO2 concentration. Okay. The response time for this electrode is approximately 2 to 3 minutes. All right. So this concludes the pH and carbon dioxide electrodes.